When a plant goes through a change in sunlight exposure, decreased water sources, or inclement weather, a plant will have a built-in mechanism to stop flowering, stop sprouting leaves, and pull back on its roots that are sent out to look for water sources. When those things come back, then it starts to revitalize and live like it always does. The hair cell in most of the patients that come to see me that are going through patterns of baldness usually suffers for some reason. A lot of people think that it's because of their thyroid, so they'll do some internet reading. They'll say, well, I have thinning hair, soft nails, dry skin, and weight gain, so I must have a thyroid disorder. And a lot of the times I'll go through thyroid testing, I'll listen to what they say, I'll either declare them as hypothyroid or subclinical hypothyroid, and we'll try a couple things. But we have to be very cautious, because if you're only using the thyroid for hair, it might be something else, and usually it is, truthfully. I have a lot of people that like taking biotin, and the studies are not that great that when you take biotin your hair cell comes back. Zinc sometimes has been touted as being great for hair loss, but again, the studies that are out there are not that strong. There are some good ones out there, but the confidence level or confidence interval is not that great. So what I usually do is say that you really should lead a healthy life. You should get good sleep. I'll notice a lot of people that go through bad nutrition eventually have problems with thinning hair. And that certainly could be with age, but why not improve your nutrition to begin with anyway, because it'll help you steer clear of cancer, heart attack, stroke anyway, diabetes and obesity. But with regards to hair, I always think that if you're having problems with thinning hair or hair loss, important to at least try to get some omega-3. It's also important to eat a balanced diet. It's very important to get a good night of sleep. It's also important to exercise. You try not to do too much damage to the hair if possible, and you go to your doctor's office to check for vitamin deficiency and thyroid disease. If all those tests are normal, you might want to try, there is a popular product with a few of my dermatologists called Viviscal. And it's a supplement, and it's kind of pricey, and I'm not convinced that it really works that great, but if you're going to go spend your money on biotin or zinc, you might as well try something that at least a doctor has recommended. Now, whether the dermatologists are getting money from Viviscal or not, I can't tell you, but it does have some nice components in it, and you can look online, vitamin C, zinc, horsetail, flaxseed, and then this combination of shark and mollusk powder. That's proprietary, so I'm not sure exactly what that does, but you might want to try it. If you're going to try anything as far as a supplement, do for about 3 to 6 months and see what happens. Viviscal is pricey. I think it was about $30 to $40 for a month, but you can give your own 2 cents and your opinion after you try it. The true things that have worked in studies and prescription are topical minoxidil. That used to be a medicine that was used for blood pressure issues a long time ago. They found that it actually helped hair come back, and now it's over the counter. If you get minoxidil, there is this one stage that when you start applying it, all the miniaturized hair follicles will actually fall off. But within about 3 to 6 months, you'll see more hairs come back. And I don't believe, with the reading that I've read, I don't believe that if you stop it, all the hair will go away. I think you'll just stop growing new hairs again. That would be the first thing, and why not use it? It comes in shampoo form, you don't need a prescription for it, and the side effects are low. Both women and men can use it. That's one thing. There are another set of medicines that block the formation of testosterone to dihydrotestosterone. One in particular is called Propecia or finasteride. And with men at least, when you block that conversion of testosterone to DHT, it actually will decrease facial hair, increase scalp hair, and decrease the size of the prostate. It was made for people with big prostates, for guys with big prostates. It would shrink the prostate, and then lo and behold, it would also bring back some hair. It usually takes about, again, 3 to 6 months. It's not that fast. There are some side effects with finasteride or Propecia, but you just have to be careful, especially if you have a history of prostate cancer. It can mask that, so you always want to be given that by a doctor and get a blood test. I've heard about some dermatologists using Avodart, that's another prostate medicine, prostate/bladder medicine, but yeah, again, you have to be careful, and that's definitely considered an off-label use. So it hasn't been approved for it, but there are people I have heard who use it. Those are the prescription modalities and the over-the-counter modalities for improving the hair growth. But again, you always have to stay healthy. If it is a stressor that you're going through, then not only do you want to get away from the stressor, you want to neutralize it. And that doesn't just mean fixing nutrition, getting proper sleep. It also means psychologically and spiritually getting some neutralizing practice of some sort to help with that stressor. I've heard a lot of my patients go through grad school, go through a divorce, go through loss in the family, and then have thinning hair right afterward. And I think there is something of a mechanism that isn't really found in a lot of studies, but it's seen in case studies. So when you have hair loss or thinning hair after a big stressor, it wouldn't hurt to go through some either counseling or some form of meditation practice to help, again, to help neutralize the stressor. If the bottom line is with stress, if you have a high secretion of the stress hormones, cortisol, androgen, testosterone, epinephrine, adrenaline, then you want to neutralize that with oxytocin, serotonin, all the love hormones. And you can take medicines for that, but why not try to practice? And again, if you develop some form of relaxation practice, like all my other videos, it'll help with every other medical problem that is known to man too. So it takes some investment and takes some practice. And again, you have to be patient, but if you have been cleared of medical conditions by dermatology or primary care, then that's when we say get a healthy diet going, consider nutrition, but also see your doctor and make sure that you have maximized, especially if it's getting to the point where you're becoming embarrassed, have to wear a hat, or you're avoiding social situations.